A stroke is when there's an interruption of blood flow to the brain, whether that be through a clot or through bleeding.
A severe headache, it could be a loss of consciousness, it could be a deficit on one side, paralysis, somebody not being able to use their left side or their right side, their speech becoming very slurred and or mumbled, not being able to understand them.
A stroke is like a brain attack. Everybody's heard of a heart attack. This is a brain attack.
The time these symptoms started is very important.
So there are certain questions that the telecommunicator is going to ask of the caller that is going to then indicate whether there are strong signs of stroke or not.
And that'll help our medics know, this patient is having symptoms of a stroke. It's very important for these medics. They get on scene and they need to get this patient to the hospital as soon as possible.
Certainly it is in the best interest of that patient to get them to that higher level of care immediately. So if we are in close proximity to UNC Rockingham, that transport's going to UNC Rockingham. In close proximity to Reedsville, certainly we would be going to Annie Penn.
Our secretary will page out what we call a code stroke, which notifies our lab team to come and draw blood work. It also notifies our CT department so that they're ready to perform certain imaging scans.
We have an emergency team that is ready to assess your needs and get your testing done as quickly as possible.
But it's all part of our stroke assessment, determining what level of severity we're at and what treatment we need to offer for you.
Oftentimes our EMS crews, the minute they roll into the emergency room, they are directed to CT and they take that patient straight to CT.
Our goal is to give the big clot busting medication T&K within 45 minutes. Our best time yet of being able to give that is within 20 minutes of a patient's arrival. And we're able to do all of these things because of our teamwork approach that we use with EMS arriving at the scene and getting in contact here with our hospital, and then us here at the hospital being prepared to start those interventions for you once you arrive.
Keeping these patients in county is, again, a life-saving measure for the patient.
It's going to seem chaotic and there's a whole lot of things going on, but this is our job. We do this every day.
There's a lot that goes into treating a patient that's having a stroke. And it all goes back to the time from when you recognize your symptoms to calling 911, EMS arriving, and then bringing you here to the hospital for that care. So we're able to provide that initial and immediate care so that we can give you a better outcome.